Well, hello, I'm Dr. Samer Hasan with Cincinnati Sports Medicine and Orthopedic Center. I'm a shoulder and elbow surgeon and treat a variety of shoulder and elbow conditions. It's that time of the year when the Western and Southern Open is upon us, and so I thought it'd be a great time to talk to you a little bit about tennis elbow or lateral epicondylitis. Tennis elbow is by far and away the most common elbow condition that I treat in practice, and it basically is an overuse condition or inflammation of the tendons that attach to the outside of the elbow. And although we call it tennis elbow because of its association with the game of tennis, the reality is that the majority of patients that develop tennis elbow do not play tennis and instead develop this overuse during a variety of activities. So, for example, tennis elbow is common amongst office workers who do a lot of keyboarding or typing. We see it a lot in certain factory workers that do a lot of repetitive work on an assembly line. We see it in vocations like carpentry, and we see it amongst butchers, for example, and in various walks of life. That said, it is definitely common amongst tennis players. And it's especially common amongst tennis players between the ages of 30 and 50, and especially those that play several times a week for an hour or two at a time or more. So you see it amongst a lot of the tennis pros at your local clubs, and you see it amongst some of the tennis players both at a professional level but also at higher level amateur ranks. And it is a condition that will resolve in the majority of cases, so that the treatment that we typically recommend and provide is non-surgical and is aimed at alleviating or diminishing some of the symptoms. So patients will typically have pain along the outside of their elbow. That's worse with gripping and repetitive movements. They may have pain when holding on to something tightly, so for example, a tight grip. And so some of the strategies that we provide include rest or avoidance of the activities that aggravate it. So for a tennis player that plays a couple of times a week, perhaps taking 2 or 3 weeks off can be helpful. For someone, it may be making some ergonomic adjustments. For example, in their in their workplace, excuse me. So those are things that can be helpful. Other interventions include anti-inflammatories. For example, as long as they don't upset your stomach and they're not otherwise ill-advised, so everyone has to check with their family doctor or their local healthcare provider. But anti-inflammatories can help with inflammation. Ice can do the same thing as well. There are some simple stretches, and I'll try to demonstrate those. Stretches like this. Stretches like this can help stretch the tendons and the muscles that attach to those tendons, because these tendons start at the elbow and then go down to the wrist along the top of the wrist. And so they're important for stabilizing the wrist, for example, during gripping, for example. So we talked about anti-inflammatories, activity modification, simple stretches. There are also some braces that can be helpful. There are counterforce braces or bands that are worn just below the elbow crease, and also a wrist splint similar to what you might use it for carpal tunnel syndrome. Those can also be very helpful as well. So, and those are worn at night. The brace would be worn then during activities during the day. Finally, corticosteroid injections can be performed, but they typically help only to sort of get over the hump when the pain is so severe and interfering with basic activities. They typically are not repeated on a regular basis, but maybe performed once or twice as needed. When those interventions fail, surgery is performed, and the surgery has an excellent success rate, probably over 90%. And yet surgery is performed infrequently. In fact, when I looked up the first 1,000 patients that came in for tennis elbow to seek treatment, we found ourselves doing surgery on somewhere between 90 and 100, so just about 10% likelihood of surgery, and that's reassuring that 90% of patients will get well without surgery. Now, to talk about tennis, there are some things that are helpful to try to either control the symptoms when one has tennis elbow, but also, more importantly, to prevent the onset of tennis elbow. They include proper mechanics. This is a very common condition in folks that have, that have sort of flat strokes, both backhand. So a two-handed backhand helps dissipate force, and that's why we see a lot of players use the two-handed backhand. We also see a similar condition in folks with a very large topspin, and that's medial epicondylitis or medial tennis elbow. That's also called golfer's elbow, but ironically we see it in tennis players with a big topspin. Going back to tennis elbow, some of the preventive strategies include choosing a grip that's a little bit on the large side, because that helps actually avoid gripping too tight, which is what happens if the grip is too thin around. So over grip can help. The other advantage of an over grip is it keeps things dry, so you don't have things slipping, and you avoid having to do these sudden turns and rotations of the wrist. So those are some of the strategies that are helpful. Other things include choosing a proper racket. Rackets need to be kind of top heavy, because those will resist torsional forces or rotational forces and help stabilize the racket during ground strokes. We talked about some of the preventive strategies, again trying to prevent tennis elbow. Important to have good technique, clearly, so a two-handed backstroke helps dissipate forces. Having good mechanics, knowing how to use your arm and generate power with the rest of your body, sort of what's called a kinematic chain. For example, you don't serve with your wrist or elbow, you serve with the muscles of your hip and back, and the muscles around your shoulder blade. They're all more powerful. There's also importance in doing stretches, for example. The types of stretches that I alluded to earlier can be very helpful, even if you just do it for a few minutes before starting your match on days that you're not playing. But another thing to talk about is the importance of proper equipment. And so there are really three elements. First is to have proper grip, and that grip should be, if anything, a little bit on the large side. So oftentimes the over grip helps keep things dry, helps prevent slippage, but also avoids a situation where you've got a grip or handle that's too narrow, and then you're having to squeeze too tightly, because that'll help accelerate or flare up those tennis elbow symptoms. So over grip is certainly something helpful. The other thing is finding that balance in terms of racket string tension. For example, if your strings are strung loose, that's ideal because it helps dissipate stresses. That's easier for tennis elbow. But if the strings are too loose, you're also going to lose control. So you don't want to go in that extreme. You know, they used to talk about Bjorn Borg stringing his tennis rackets at about 80 pounds per square inch, which is almost double what John McEnroe used to do, for example. The problem with that is these would often break the rackets and would be very, very hard for most of us to play with. So you just kind of keep that in mind. The other thing is some of the durable strings, while you think you'll save you a lot of money because they'll last longer, the fact of the matter is these may be the worst for tennis elbows. So you really want to think about that as well. It may be okay to string and have your rackets restrung on a regular basis if you play frequently. And finally, the tennis balls. Clearly, when they're really flat and dead, you're going to be having the types of forces that are not going to be dampening. They're not going to bounce back as truly, and you're going to wind up with a lot more force transmitted that can accelerate or perpetuate the tennis elbow and the tendinitis on the outside of the elbow. So those are some things to keep in mind. Thanks a lot.